back to school for hundreds of thousands of children in Canada today. A full schedule of classes begins in New Brunswick, Nova Scotia, Manitoba, and Saskatchewan. There are staggered starts on PEI and in Ontario today. Governments have spent billions since March trying to minimize the risk of COVID-19 in schools, but for some parents and students, it's not enough, and they are opting to shift their studies online.
In my household, I have someone who's immunocompromised, and the idea of going to school and then maybe bringing COVID back home is just something that I'm not that comfortable with.
Canada's top doctor, Dr. Theresa Tam, just as classes resume, has been expressing concern and caution over an uptick of cases. Over the past week, an average of 545 Canadians each day have tested positive. That's an increase of 25% from the previous week. And of course, when it comes to school, if the risk of community transmission is low, the risk in school is low. That's the thinking. The uptick in numbers is raising concern for some. We know you have questions, so we have assembled a wonderful panel of experts to answer your questions this morning. Child psychologist Dr. Jillian Roberts, the clinical founder of Amira Health and an associate professor in the Department of Educational Psychology at the University of Victoria. She's in Victoria. Nice to see you again, Dr. Roberts.
Nice to see you.
With us from Ottawa is Dr. Nisha Thampi, who is a pediatric infectious diseases physician. Welcome to our program, Dr. Thampi. And also in Vancouver, we have two heroes who are getting up super early. We have online learning expert Dr. Marina Milner-Bolotin, who's a professor of science education at the UBC Department of Curriculum and Pedagogy. Welcome to you as well.
Thank you so much for the invitation.
Well, listen, we're looking for all of this. And again, just want to reiterate, you're watching here on CBC News Network, but on our streams as well, Facebook and YouTube and Twitter. And you can send your questions into us through those channels as well. But let's begin. I'm just going to go around the horn very quickly to each of you. If you could just sort of one sentence, I'm interested in what you think the #1 issue is in your particular specialty for back to work. So Dr. Roberts, what's #1 thing on your mind this morning?
Parental anxiety.
Parental anxiety. Excellent. And I want to ask you more about how not to transfer that anxiety. So we'll get into that. What about you, Dr. Thampi?
So we know that we're going to have cases entering the school, but it's really about ensuring that the cases are contained and that we don't see spread within the schools.
That's your #1 issue. And Dr. Milner-Bolotin, what about you?
I'm thinking of parental involvement
Parental
in learning.
anxiety, parental involvement in online learning. Well, we have questions about all of that from some of our viewers who've already submitted questions, and I'm certain we'll get more either online and also, of course, through our social media channels. Let's bring in one of our very first video questions, and this will be to you, Dr. Roberts, from Ava Steele and her daughter, Claire. Let's watch this together.
Hi, this is Claire and Eva from Toronto.
Hi there. I have a 6 and a 9-year-old going back to school, and I have a question about prolonged mask use. I was wondering if it had some negative effects on your body, such as breathing in less oxygen or breathing in your own carbon dioxide. I'd love some expert opinion on this. Thank you.
I'm going to do this for both Dr. Roberts and from Dr. Thampi, but I'll bring in Dr. Roberts first of all because we've been talking about this on our program before, the psychological component of kids wearing masks and teachers wearing masks. What are the effects of this?
Well, I think if we frame this positively to children, I think that they're going to be okay with it. You know, I have an 8-year-old, and he got to pick out his own mask with kittens on it, and he's quite comfortable wearing it. The one thing that I would suggest is that the mask be very light. So the N95 masks are very many layers, and I think those can be harder to breathe through. But the simple cotton masks that have like a looser thread count, I've had no trouble at all in having my son wear them for prolonged periods of time.
This is a concern, the lack of comfort, young people having to wear these for a long time. Dr. Thampi, if I can bring you in on that, because Ava and Claire were also interested in the physical effects of prolonged mask wearing, breathing, carbon dioxide, things like that. What does the science tell us about any negative health repercussions?
Right, so there is no compelling evidence of physiologic changes that come with wearing loose-fitted masks, as Dr. Roberts was pointing out. In rare cases, there may be people who are not able to wear masks due to specific and severe respiratory conditions, and that's reviewed on a case-by-case basis with their clinician and the school team.
And then if I could, Dr. Thampi, carry on with this for just a second, because we've had a couple of questions submitted on Twitter. Paula, I'll read them to you. She writes that her son is going into grade 4. He's mandated to wear a mask in class. He's in a grade 4-3 split. Grade 3s are not mandated to wear masks in class. So Paula's question is, should she be concerned about that? And tying in with Cora's question from Toronto and a teacher, she teaches in a grade 4 class where the students are required to wear masks during the day, but at lunch, they are to sit in the classroom and eat with their classmates with their masks off. Does this not negate all the other mask wearing if they'll be spending 30 minutes together unmasked? I can see that, the masking policy, and it differs from province to province, and it differs according to age. It's a little bit confusing. But based on those two questions, Dr. Thampi, what would you like to add?
So this is definitely a concern that we've been hearing a lot from families about masking and differences of between jurisdictions. Masks are one type of intervention to help us prevent the spread of infection. They're not the only ones that we have in place, and that's where physical distancing, whether it's 1 meter or 2 meters, staggered lunches, forward-facing seats, and improving the ventilation system and screening individuals, which is one of the most important strategies that we have to keeping COVID-19 out of school. These are measures that we want to see in place at the start of the school year and improved upon as people get used to these new behaviors. So with the grade 3 to 4 split class, it's interesting because one of my kids is in one of those, and they have similar rules between the grade 3 and grade 4 students. So there is mandatory masking. So there may be a conversation there. I'm not suggesting that that's the best strategy, but that's one example of how there may be adaptations to provincial regulations, as well ensuring that the seats are as distanced as can allow for that classroom and smaller cohorts, of course, and then those other higher level of controls in place. As to sitting down and eating lunch at their desks, well, when they're sitting down in one space, we know that lunch is very social and that the risk of spreading infection may be significant there because they're eating, their masks are off. But again, depending on how they are placed, the risk may actually still be fairly low.
Thank you for that, Dr. Thampi, and for those questions on Twitter. Jason and Suzanne have our first questions coming in live from our social media platforms, and I will get to those in just a second, but I want to make sure I bring in Dr. Marina Milner-Bologton as well for the question. We have a video question for you from Dr. Tatiana Ogurtsova, and it's a good one. It's about online learning and making sure that kids stay engaged. So here's your question on video.
Good morning. My name is Tatiana Ogurtsova, and I'm from Montreal, West Island, and a mom of a 5- and a 9-year-old. I would like the panelists to comment on what are the known and the potential negative side effects of online learning on children's overall development, their attention span, the development of other cognitive skills and abilities, their behavior, and the learning efficiency.
Excellent question, and to you for an answer.
That is a good question. However, in my view, the question is a little bit broad. Online learning includes a big span of different strategies. So when I say online learning, it's not clear to me what to include there. And that's the main point about online learning. A lot of us parents, we weren't educated in the times that our kids are being educated. So right now there are so many opportunities, and that's why I said parental involvement is so important. I think it all depends how the parents will organize online learning, what resources these kids will be using, what assignments they will be doing. So in my view, I cannot say what the negative effects are, because I cannot even say what the positive effects are, because it depends how the online learning will happen. Okay. But one thing I can tell, that it's very important that a child is spending the time in front of the computer in a meaningful way.
And what do you mean?
And that's where the parents come in.
Where the parents come in. So help us. I mean, obviously this is probably a very long answer, but can you give us the main points for how to have the parents involved in a meaningful way and to have a really positive, engaged child doing the studying at home?
I think the most important part is to organize the space for the child and the planning, the schedule. How much time will they spend online? What will they do? What will their accountability be? Because it's very easy to go online and spend all the time on Facebook or social media. How do we create the online space where there are as few distractions as possible? What will the child be doing online? How will we support the child when they're stuck? What resources they will be using? And that's where also the school districts come in. A lot of them, at least in British Columbia, have purchased different software that will provide feedback to the child. And I think what the parents can do, they can monitor that, get involved, and support, create this virtual space for their children.
Dr. Roberts, let me bring you in on this because, again, this is something we were talking about just the other day. For the many Canadian families who've chosen to go with online learning and homeschooling, it means minimal or lessened social interaction for those children. What are the concerns you have about their psychological well-being? What do parents need to keep in mind if they're opting to keep their children at home?
Parents need to then find lots of other opportunities for kids to connect. So for kids to connect within their bubble after school or on weekends, to allow kids to Zoom in and have play dates or to see cousins, and to remember many of the video games. I know most people are really anti-video game, but video games can have their place. And the multiplayer video games that are not violent but creative in nature, kids can have a lot of fun playing a game with a classmate in a cooperative fashion online. So, come up with lots of ways that you are still connecting your child with other children.
Okay. Thank you, and thank you for the question. A couple of questions for you, Dr. Thampi. This is from Suzanne Brennan, who's following along on Facebook. What's the plan if someone in a classroom tests positive?
It's a great question, and it's important for us to hear about as we know there are kids who are school-aged who are making up our case counts across the provinces now, and these school-aged kids are going back to school. So those the plan for a positive child is outlined in every provincial public health document on return to school. But generally speaking, with the identification, they are sent home with their parent, and then the decision is made by public health about whether they need to isolate the entire classroom or part of a classroom. And the child who is sent home, that they have to be isolated tested and isolated pending the results of their testing. Their family have to be isolated pending results of that testing.
Okay, so Julie Jameson wrote in saying, I'm a parent with children in different schools in a situation where one child is required to self-isolate along with their cohort at one school. Will the sibling need to do the same?
So it's a good question because it relates to whether the sibling was a contact of a classroom case versus being symptomatic with COVID-19. And that nuance is being clarified by various public health units, but generally speaking, when a child has symptoms that are consistent with COVID-19, then the entire household needs to be isolated.
For you, Dr. Marina Milner-Bolotin, this is Terry Triflin who's writing in on Facebook. What resources are available for online learning for rural families? We talk about this a lot. Internet access is unreliable or non-existent or financially unaffordable. So any resources you might suggest?
I think there are many. I mean, they need to check if they have libraries. They also have a lot of school districts now will be sharing books and other resources with the students. So I'm sure the rural school districts have some plans of how to share these resources. But I also wanted to mention that a lot of software that is amazing learning software you can download, and it takes time to download, but then you do not need to be online. And on my website, they can Google me up. I put a collection of different kinds of software. For example, Duolingo, a free language software, you do not need to be online to enjoy it, and other software as well. So I want to say that there are resources and the parents have to be proactive, but it is important to be online at least to find out what is there. So maybe they can find some spots where there is good internet, do their homework, find the resources, and then use them at home.
All right, thank you. Very concrete tip there. I appreciate it. A question for you, Dr. Roberts, from Annika Burmeister, who's a middle years teacher, and she's wondering how she positively spins what her students are able to do when there are so many things that her students can no longer do because of restrictions. So how does she frame this to focus on the positive?
I think there's always silver linings in difficult situations, and having the children brainstorm things that they're kind of happy about, things that they see as being a plus, and creating, a positive list where every day there gets to be something that they all enjoy doing. Yes, it is incredibly important to frame it positively, engage the children in picking their favorite activities that they still can do. Maybe bookend your school day where you start with something that is positive and fun and end with something that is positive and fun. Remember, you don't need to have super, super high academic expectations right now. You want to keep learning and you want to keep inching towards those learning outcomes of the ministry, but you also want to make sure that children feel safe and are happy to be at school, are connecting with other kids that they haven't had a chance to. Parental anxiety is reduced as much as possible, and that you're not putting too much stress on yourself.
You're watching CBC News Network, and for the future, for the foreseeable future, as long as your great questions keep coming in, we are speaking to our panel of experts, child psychologist Dr. Jillian Roberts in Victoria, pediatric infectious diseases physician Dr. Nisha Thampi in Ottawa, and online learning expert Dr. Marina Milner-Bolotin in Vancouver as well. Thank you for your questions that you've sent in to me personally, but also on our YouTube, Facebook, and Twitter pages, and we continue on with those. Jason Craig, Dr. Thampi, would like to know about this. What are the case numbers of MISC, so multisystem inflammatory syndrome in children? What are the numbers looking like right now, and should we be concerned?
Great question. So the numbers are very low across the country. I think this is absolutely a serious condition, but it's incredibly rare, and it has stayed very uncommon among our pediatric cases. The overwhelming majority of children do not need hospitalization. They get tested because they have mild symptoms, and there's liberal testing available now. There wasn't before, and very few have ended up being hospitalized, and even fewer needing intensive care across the country, less than 5.
Okay. Thank you. Good information. And again, that's something that's been a big issue and very frightening when we first saw cases in the United States and the couple reported in Canada. Question both for you, Dr. Milner-Bolotin, and I think I'll get Dr. Roberts to respond as well. Terry Treflin writing back on Facebook, how will screen time affect kids' mental development, online learning? How many hours of screen time will this entail, and how will it affect development? What do we know about that? Dr. Milner-Bolotin.
I'm not an expert in psychology, so we have Jillian who'll help. But I wanted to say about the screen time and about the parental anxiety involved. First of all, again, our upbringing as parents, we're older obviously than our children, is very different than of our children. They will be engaged, they will be in front of the computer screens. When we were growing up, and a lot of us were in front of TVs, and I'm sure that just passively watching something on a computer is not the best thing possible. However, there is a silver lining. When you're engaged with a computer and it's in software or some other engagement where the child is receiving feedback, I think you are developing, and in some ways the kids can get much more feedback than they got in a regular classroom. Today we have a myth that face-to-face learning was ideal for every child and online is going to be bad, but I think it's not true. A lot of kids can do much more make much more progress online than they can do face-to-face, provided, in terms of learning different things, provided they use the right resources, and again, the parents support them. So one small thing I wanted to add is, when you are sitting in front of a computer, you can be, of course, passive, you can be active, but you're still sitting. So what is important for the parents to organize the day that the kids are also physically active, because it's not good for adults or for children to be sitting all day long. So that's one of the concerns that I think very legitimate for the children.
And Dr. Roberts, I'll get you to add on this, if you would, in terms of what do we know about psychological impact of this type of online learning?
I think it's really a question of balance. You know, you want to make sure that the child has breaks through the day, that once they start to wiggle, you have a movement break. You know, I make my son run around the back garden. So I completely agree that there needs to be physical activity, but you also need to think about online learning as very concentrated, focused moments that are spread out through the day, with breaks and snacks and, reading, other things to make it, a balanced day, not just like an entire day zoomed in.
Thank you to all three of you. And thank you for all of those fantastic questions here writing into us at CBC News Network on Facebook, on YouTube, and on Twitter. Dr. Jillian Roberts, Dr. Nisha Thampi, Dr. Marina Milner-Bolotin, I appreciate all of your time and sharing your expertise with us and our viewers this morning. Thank you.
You're welcome.
Thank you so much.